Okay, let's paint a picture. Make it big, pointing out the pressure. Patriarchy has become official, so let's talk about it, cause I'm seeking closure. Women have a different set of rules, but they should apply to your gender too. You judging me by the way I dress, while you walk in the streets with a bare chest? Yeah, bare chest, man, it's double standards. You teach it loud, but you can't stand it. You cheat on me many times, but when I do it once, you act like your life's ending. Let's talk about rape, discrimination, narcissism, that determination. To subjugate women and make them slaves. On domestic abuse, we can dig in grave. Fall up in my face, stop my man. Generating fear like the boogeyman. You think you know women, you're very late. Cause pure opinions, bro, you can't relate. So drop the axe at the record scripts. We done eating from an empty plate. I carry a child for 9 months, man, I bear pains you will never take. You say that women are the weaker vessel. If that is true, then we need protection. If you all were doing your jobs as men, we wouldn't be having this conversation. If I get a job, then you say I slept. If I don't, you say I'm a lazy wreck. But I'm a leader, then you feel threatened. Every day my existence is being questioned. Stop the bias.
If you all were doing your work, then you're talking about gender equality, then you're talking about you the main in relationship. If you all were doing your work, we wouldn't have been doing what we are doing today. So this is a direct message to all of the females out there. Thanks for joining us today. Welcome to the Focal Women Talk. I am your usual host here. My name is Queen Encourage White, talking about issues relating to us women. I like to do away with some titles and just called meaning courage. So today, of course, we have few important things we're going to be talking about. We should have had our guest on maybe a contraceptive pills today, but unfortunately, she sent a message that she can't be here. She will take a shot next week. So we're hoping that next week we can close up with the issue of contraceptive as a female. So today we will be talking about the methods, the effect, the advantages, and the disadvantages of birth control pills. So sometimes we hear birth control, birth control. What is birth control? Why is it people take birth control pills? Why is it people take the injection? The last week we talked about the IUD injection. That is another method of contraceptive. So we learned that contraceptive has to do with the prevention of pregnancy. Contraception has to do with the prevention of pregnancy. So those pills we take, the IUD, they are all contraceptives method. So of course you ought to know these things so that when it reaches a point in your life where you have to make certain decisions, you will already be in the know of all of these things that we are talking about. So, of course, today let's jump quickly to birth control. But before that, if you are watching me, can you please make use of the comment section? Can you please follow Focal on TV? Can you share our live stream? And can you comment in the comment section? I will appreciate all of the viewers who are following me or who are always watching me to comment in the comment section because we have a surprise coming up for all of our followers. So just do me a favor, comment in the comment section on the issues related as it relates to the Focal Women talking our topic for today, please. So of course we're talking about birth control pills today. And birth control pills are a type of contraception that's 99 effective at preventing pregnancy. The last time we talked about contraception and contraceptives in general, we said it's 99%, it's not 100% at all times. So just so you know that. So the pills contains hormones that regulate menstruation, decrease PMS symptoms, lower the rates of ovarian and uterine cancers, improve acne, and treat endometriosis. So of course, I'll just do a rough overview of the birth control pills quickly. So birth control pill is a type of oral contraception. It's oral because we basically take it by pills. Oral contraception that uses hormones to prevent pregnancy. Oral means you take it by mouth. Of course, that's what I said because we take it by our mouth, so it's oral. So contraception is any form of birth control. Get that straight. Contraception is any form of birth control, any device or method to prevent pregnancy that is contraception. And I said it from an earlier stage a few weeks ago that contraception is any method to prevent pregnancy. It can be the injection, it can be the condoms. So if you don't be outside there telling your friend, oh, I want contraceptive, or I don't contraceptive, I can only use condom. What is condom? Condom too is a contraceptive by itself. It's a contraception method. So you have to understand that. People call it a pill because it comes in pill form that easier to take. Of course, it is easier to take. We have the layer pills now that is very very easy, only one, and they have the other birth control pills that have the white. It looks like cream in the brown. So for many people, the pill is just one part of their daily routine. So that brown and white pill that have the instruction on it, where you see the arrow, is there. People take it daily. Once you decide to prevent pregnancy, if you want to get a family planning, and you start watching your contraception method, and you decide to get on the pills. Of course, the birth control pills is that one I gave the instructions. So birth control pills prevent 99% of the time when you take them every day exactly as prescribed. So when you take them every day, it prevents pregnancy 99%. Unlike other types of birth control like condoms, the pill doesn't protect against sexually transmitted infection. So unlike other methods like condoms, the pill doesn't prevent or doesn't protect you against sexually transmitted diseases or infections, sorry, that is the STI. So the pills is there, it will help you to prevent pregnancy, but then the pills will not prevent you from getting sexually transmitted infection, or it will not stop you from getting syphilis, it will not stop you from getting hepatitis B, it will not stop you from getting those things. The pill is just there to prevent pregnancy, unlike condoms. So that is the reason why the last time I told you, young people and grown up women, that one of the best methods you could use is condoms. I know sometimes at that particular moment you hear people saying I don't like condoms and my partner doesn't like condoms, but if you decide to choose a method, I think the condoms method is one of the best method as it relates to pregnancy, as it relates to sexually transmitted infection and other stuff. So most of the time condoms is well protective as it relates to our body, our health in terms of infections. Then the pills will help you and I get pregnant, but then it doesn't help you when it comes to sexually transmitted infection. And I think the condom does. The condom protect you from pregnancy. The condom protects you from sexually transmitted infection. But in so doing, the condoms is not also 100%. No aspect of contraception is 100. No method of contraception is 100%. Reason why there's a likelihood that anything can happen. Why am I saying this? It's because, for example, you see sometimes people say, oh, we usually use condoms. Sometimes you have the condoms will burst. At times it happens. And then even for the pills, that is the 1% aspect I'm talking about now. That is the pills. Even the pill is 99%, but sometimes when you're on the pills, you kind of forget to take your medicine, you go and have intercourse, and sometimes the likelihood for you to get pregnant. But with condoms, there's a likelihood in some occasions or on some occasions due to your partner, however it is, sometimes the condom will burst and the likelihood there for you to get pregnant. So it's not roughly about 100%. It's contraception as a whole is 99%. So condoms is well protected. It protects you from a lot of things. It protects you from pregnancy. That's the reason why it's a contraception, and it also protects you from sexually transmitted infection. So if you are someone who can read or listen very well, you will understand that the issue of the birth control pills, when you read on a part, you don't just take these are things I feel young people should be crucial about. Whenever you have the opportunity to take pills, things that are relating to your health, you have to be mindful about it. You have to read. You don't just go to a friend, or you don't just eavesdrop a conversation. This person tell you this work for me, so you go ahead and use it without reading or without getting extra knowledge on what you are about to do. So most of the times, and I stated it the last time, if you want to get on any aspect of contraception, if you are interested in the methods of contraception, you want to get on it, it's good you visit a doctor. It's good you be in the know of all of these things because it is important for you. So If, for example, you buy the birth control pills, and that is the one that have 30 pills on it, small, small, right? You when you read down, it tells you that it does not protect you from sexual transmitted infection. It tells you that indicated even the new linear pills that is in town that is roaming all around, they want to have the single pill on that. It also could show you about that, and also mention about the ovulation. When you are ovulating, it doesn't work. As female, when we have our ovulation time, right? So when you are ovulating, it's time that you be very, very careful, because if you depending on lady or contraceptive pill while you are ovulating, you will be mistaking yourself. So these are all important things that I want to talk about. So of course, condoms is the best method you can use. You will need to use additional protection along with a pill to reduce your risks of STIs. So of course, when you are using, I don't know, somebody can say double, you double tasking me, but it's good enough. If you don't want to get down with sexual transmitted infections, it's good that you sometimes use more protection as it relates to you, because the issue of the pills, the issue of the birth control pills that you take every day to prevent family planning, that's how we call it. The issue of the birth control pills that you take every day, it does not prevent you from getting gonorrhea, it does not prevent you from getting syphilis, hepatitis B, HIV, and AIDS. It does not protect you from getting that. It only protects you from getting pregnant. That's the only thing. But the one of the best contraceptive measure you can use is the issue with the condoms. So they say what are some types of birth control pills? There are two types of birth control pills. Both contain hormones that keep you from getting pregnant. So it talks about the combination pills. It contains estrogen and progestin, and this is the most common type that most often is being used. And they have the progestin only pills. That is another one, and it's also called a mini pill. They may be better if you are breastfeeding, chest feeding, or whatever it is, or have a history of clots in your legs or lungs. So it is preferable if you have these medical issues, the progestin only pills that is commonly called a mini pill. But if you are not having some health issues, you can use the common one that is the combination pills that contain estrogen and progestin. Sorry. So the morning after pill is a type of birth control that can take in emergency situation when you are not using typical birth control and you are at risk of getting pregnant. So of course we have these Lydia pills. That's the reason why I wanted for Lydia to be here today or representative from them. But fortunately they are not here today. So when you are not on contraception, or you are not taking any method of contraceptive, but you don't want to get pregnant and you go and have an intercourse, there's this morning pills, or there's this pill that you can take is used for in emergency situation where you don't want to be messed up as it relates to pregnancy. So you sometimes take the pill, and I think you know the pill is a new pill now, maybe a contraceptive. In other countries they have different brand of it. So I'm gonna be talking about how effective is the pill. So the pill is 99% effective at preventing pregnancy. The pill is 99% effective at the back of your mind. If you decide to get on the pill, be reminded, if you are on the birth control pill that you take every day, be reminded that it does not prevent you from getting down with infections. It does not prevent you from getting HIV and AIDS. It only prevents you from getting pregnant. This is how it is. So in order for you not to get pregnant, and in order for you not to sometimes be caught up in a moment where you'll be down with gonorrhea, syphilis, you'll be down with hepatitis B that is all around. The best method to use is condoms, or better say double tax yourself. You get on your pills and you use condoms if you are not sure about the person health sector and health issues. So you see, in Liberia, we sometimes don't want to have this conversation because I'm shy, because all the people around you talking that type of routine, and sometimes females get the mindset of doing those things, right? But you have to be very, very careful. These things are very, very important, because this is where your future lies. This is where your body matters. So I should be, if I'm not sure about your health, if because sometimes we just sleep around for a particular reason or no good reason, or I just like him. And mind you, people faces are different, so are our health issues. So I mean, meeting a guy for the first time and you don't know him and you just got up in a moment, you have to be very, very careful. You have to take all of these things into consideration. No, you don't say, "Oh, I own my pills, man." No, no, no. The pills does not prevent you from getting any deadly infections. The pill does not prevent you for that. You are open up to any infection. And this time around, hepatitis B is all around the country. And it's very deadly. This is the reason why you see young people are dying, and our government are not really, really talking about this. But hepatitis B is bad. It sometimes gives you big stomach, and yeah, people are like say, "Oh, the person knew they do this." No, no, no. They did not person him. Not in all situations. Some people are down hepatitis B. Hepatitis B can be spread through fluid. Hepatitis B are really, really transferred through sex. So you all need to be careful as it relates to these things. So of course, I just talked about the pill is not 99% effective as it relates to protecting you from infection. But only if you take it every day, it protects you 99% of being pregnant. If you take it every day, if you are on the pills, the birth control pills that you're supposed to take every day, please do the necessary and take it every day. It will help you prevent you from pregnancy. If you don't do that, sometimes you jump in a medicine and then go and have intercourse. You sometimes get pregnant. Say, I don't even know how it happened. Yes, you know how it happened because you skip your medicine. So that is for that. So how does the birth control pills work? So in our body, the hormones in birth control pills prevent pregnancy by blocking conception. Of course, it block conception when sperm fertilize an egg. It will now work out, and they also cause changes in your uterus so that it can support so that it cannot support a pregnancy while you are on the pill. So it supports and it causes some changes in your uterus. That is your womb. So birth control pills also stop or reduce ovulation. You know, most of the times we have our ovulation period apart from, I'm saying period now. We have our ovulation time aside from our menstrual time. So it helps reduce ovulation. That is the release of an egg from our ovary. It helps reduces that. And then taking cervical mucus, creating a barrier, and all of those things we talk about as it relates to the IUD, it helps in a whole lot. And so, when should I take birth control pills? I know this question will come about. When should I take birth control pills? You should take birth control pills as prescribed. You don't just take birth control pill because your friend taking it, so you won't get pregnant. So you take it because your friend told you about it. So when should I take birth control pill? Take them exactly as prescribed by your doctor, not your friend, not your intake, but your doctor. The pills comes in different dosing packets. It comes in a 21-day pill packs. It comes in a 91 day. It comes in 365 days of pills. Not all pills are in packet are the same. Not all pills that are in a packet are the same. It sometimes comes in 30 days. What we have in Liberia that I have seen, and I haven't seen the 91 days yet because I'm not a fan of it and I don't go for it. I don't go for the contraception method of birth control is the one we have for 91 days or 365 days. I've not seen. But all packets are different. When you take some of them, depends on which kind you are using, you need to take the right pill at the right time. So it's not because you won't take the pill. The first thing, when should I take birth control pill? It should be prescribed by your doctor. I want to get on family planning. Your doctor has to do your medical checkup, look at your medical record before he can prescribe which method to use. And if you say you want to use the birth control method, if it suits you, you have um you have to have a time set to take your pills. And the pills you'll be taking will be kind of different from the other ones your friends will be taking as well because everybody cannot take the same thing. People have different choices and what works for them. So you have to follow the instruction on the packaging or ask your provider or from a pharmacist if you have questions before you start. That is okay enough. So I'll quickly run I'll quickly run. Before I take this break, it says, how soon does the pill work? That is one. And the next thing is, what should I do if I miss my pill? How soon does the pill work if I'm taking it? And what should I do if just in case I miss my pill? So these are all questions. I encourage you to please make use of my comment section. We have a lot of people watching us, but they have dropped. Don't know why. We'll take a break, and when we get back, I will fill you in on how soon does a pill work and what should I do if I miss a pill. Thanks for joining us so much. I appreciate you, and I'll be right back shortly with another interesting question and answer.
Okay, let's paint a picture, make it big, pointing out the pressure. Patriarchy has become official, so let's talk about it, cause I'm seeking closure. Women have a different set of rules, but they should apply to your gender too. You judging me by the way I dress, while you walk in the streets with a bare chest? Yeah, bare chest, man, it's double standards. You DJ loud, but you can't stand it. You cheat on me many times, but when I do it once, you act like your life's ending. Let's talk about rape, discrimination, narcissism, that determination. To subjugate women and make them slaves, on domestic abuse, we can dig in grave, fall up in my face, stop my youth man, generating fear like the boogeyman. You think you know women, you're very late, cause pure opinions, but you can't relate. So drop the axe at the record strips. We done eating from an empty plate. I carry a child for 9 months, man, I bear pains you could never take. You said that women are the weaker vessel. If that is true, then we need protection. If you all were doing your jobs as men, we wouldn't be having this conversation. If I get a job, then you say I slept. If I don't, you say I'm a lazy wreck. But I'm a leader, then you feel threatened. Every day my existence is being questioned. Stop the bias. Stop the bias.
Yeah, I appreciate the advocacy, and yes, I listen to your allegations, but let me correct the misunderstanding and point out the flaws in your presentation. See, patriarchy is a word that women use every time they don't want to submit, and that is because they choose to be manipulative and put all the blame on the men. So women are never wrong, they always right. You call them out, they start to cry. You say the fact, then it's body shaming. Tell them cover up, then it's slut shaming. I walk around with my bare chest, cause I don't have to, shouldn't rest. It's simple biology, all we ask from you is decency. We are not enemies. Say narcissism and the male trait, women do it too, ask Will Smith. Domestic abuse and rape, I don't by poorly raised man, not a man. Why y'all trying to mess with God's plan? All this victim playing, I am not a fan. You talk about 9 months, but I spend my whole life working with my hands all for a woman. How is that fair? If we ain't got money, you don't care. See, I don't see women complaining about being a farmer, but y'all wanna be president. So this ain't even about equality, it's about power and mastery. Truth hurts, but it gotta be said. Can't eat your cake and have it, I swear.
Welcome back to Focal Women Talk. Welcome to where we talk about issues relating to women. Of course, I am your host, and my name is Bettina Courage. But remember to call me Courage, especially when we are talking about important issues relating to women. Please don't forget that. So, how soon does the birth control pills work? That is another question. And the birth control pill can take up to a week to start preventing pregnancy. You will need to use another form of birth control during the first 7 days you are taking the pill if you are sexually active. I think that is clear enough. And another question comes in, what should I do if I miss a pill? So take the missed pill as soon as you remember and continue taking your usual dose as planned. So for example, if you were to take the pill yesterday and you did not and you remember today, go back and take the pill and continue taking your usual dose as planned. So use a backup form of birth control until you have taken 7 days to active your pill. So you have to use a backup form of pill of birth control pill up to 7 days before you can actually take your rifle and active pills. It helps to keep package inserts hidden. Most give specific instruction on what to do if you miss your pill. So another thing you can do if you miss your pill or you feel different is to talk to your healthcare provider if you miss several days of the pill. Your provider can discuss emergency tests and emergency contraception options if you are sexually active. Should I avoid certain medication while taking the pills? These are questions. So always check with a healthcare provider before starting new medication or herbal supplements. And then we dey like bring people, we dey young person like people. We like too much of our country medicine. That's how we call it. Country medicine business we like it. And another thing again we like in our country like what is whenever we miss our medicine or the medicine we just trying to take it, we just wanted a minimum taking the medicine should start working. If it does not, then the medicine not good. We usually do it till we even do it with our skincare product. We do it with things concerning us, which of course is bad. It's you should have a limit of time that you're gonna use something for. If you see it's not working or it becomes allergic to you, you see some reactions, then you can take a step. But if you don't see any of those things, you just jump up. Boop. So what should you avoid? What are some of the medication you should avoid while taking a pill? One thing you can avoid is herbal supplements. So before you can start on any herbal supplement, make sure you check with your healthcare provider, you check with the nurse where you're going to talk to your doctor to get on birth control or family planning. Go there. So certain drugs can make a pill less effective, increasing your chances of pregnancy. Certain drugs can make the pills less effective and this can increase your chances of getting pregnant. Certain drugs. So we have anesthesia medication, anti-seizure medication, we have herbal supplement, and we also have medication used to treat HIV. The medication used to treat HIV too can increase your chance of getting pregnant if you are on the birth control pills. So there are certain medication you can take. There are certain medication you cannot take when you are using the birth control pills. When you are on family planning, you're taking the pills every day. There are certain things you have to do away with. You have to do away with herbal supplements. That is, you have to do away with country medicine. My people, you can't be on a medicine if you're taking the other medicine. It will break it, and then it will give you the increased chances of getting pregnant. So you have to be very careful. Medication used to treat HIV and AIDS people, you cannot take it as well. So another question coming: can I take a pill while breastfeeding? Your healthcare provider may recommend you taking whether the progesterone only pill for the situation where you are breastfeeding or chest feeding. So the combination birth control pill contains ingestion, which can decrease milk production. So you understand the aspect why you cannot just go and start taking birth control pills. So the reason why you cannot just go because you are breastfeeding. So this particular pills has a contains ingestion. So this particular pill that contains ingestion can also decrease the milk production in your breast. So therefore, you cannot jump and take any medicine because you want to get back on family planning. No, that's not how it works. So, however, you may be switched on an injection containing combination pill once your milk fully comes in. So once your milk fully comes in, they can switch and do whatever they have to do. So another thing you have to do is you have to ask your health care provider which option is best for you. Anytime you decide to get on contraception or to follow any method, make sure you visit a healthcare person to give you information and you yourself to pick up a book, read about these things that you want to get on and see what is good for you and see what is not good for you with a proper checkup, medical checkup on you and your health status. So rate or benefit. What are some of the benefit of taking this pill? The benefit of taking the pills correctly is you'll not get pregnant. That is birth control pill are sometimes most popular form of contraception. Is the most popular one. No, me I don't say injection they give you, it can be fat, it can be iron in you, all the different myth we have about it. But the birth control are sometimes the most popular form of contraception. It's most popular, it's sometimes dangerous if we are not in the know and we are ignorant to certain things. So people use the pill to prevent pregnancy because it's convenient. It's just you take a pill each day. It's convenient, no headache. It's not bitter. It's not sour. You just take it. It's small. You can take it. You can put it in your bag, carry it with you wherever. So these are the benefits of the birth control pills. So it's effective. It prevents pregnancy 99%. It is effective. 99% of the time when you take it correctly, 99% of the time when you take it correctly, it prevents pregnancy. These are the benefits. It doesn't interrupt the smooth aspect of sex. It doesn't interrupt it. You don't have to find birth control right when things are heating up. So that is it. And you can get pregnant soon after stopping the pill. And it's one thing when you stop the pill immediately, you decide not to take birth control pill. The minute you stop it, the possibility there for you getting pregnant is really, really high. So most people who decide to try for a baby, getting pregnant within a year after stopping the pill is positive. This is the same timeline for people trying to get pregnant who haven't been on the pill. So birth control pill can provide health benefits in addition to pregnancy prevention. The pill can make your menstrual cycle or period lighter or more regular. So it does not only prevent pregnancy, you can only enjoy the moment, it can only be effective, it can only, it's not only convenient. So it also has a lot of things attached to it too. Make your menstrual cycle brighter. Sorry, it makes your menstrual cycle that is called period lighter or more regular. It becomes more regular when you are taking this particular pill. So it prevents anemia by lightening your period. So reduce menstrual cramps. It helps. It helps reduce menstrual cramps and menstrual migraine. So that is the issue of you experiencing headache, all of those slight symptoms, it helps reduce that. It lessens symptoms of premenstrual symptom, that is PMS, and premature dysphoric disorder. So it reduces hot flashes during the transition into menopause. It reduces hot flashes, when people are transitioning to menopause. And I think all of us here know, if you don't know what is menopause, it's important that you know. Women, menopause happens to women greatly. Women who are in their early 50s, it sometimes happens to them. So you start to experience menopause. So sometimes you see women 44 years to 50 years start to get menopause. However, whatever the case, if you are on the pills, the birth control pills, it reduces hot flashes during the transition into menopause or pre-menopause. From 44 to 50, that is what we call pre-menopause, and menopause start at 50 years old. So it treats polycystic ovary syndrome, that is PCOS. It helps a whole lot as it relates to ovary syndrome. It helps you, and it treats endometriosis or uterine fibroids. Those who suffer from fibroids, uterine fibroids, it sometimes treat it, and it lower your risk of ovarian cancer. When you're on birth control, it lower your risk of ovarian cancer, uterine cancer, and colon cancer. It stops unwanted hair growth and clear acne. So it helps to it helps to clear acne. That is the pimples we experience on our faces. I think I would call pimples is different from acne. I'm sure about that. So we have to be very careful how we use the both words. It helps a whole lot. So does the pill prevent sexually transmitted diseases? No, I said that to you ever since it does not prevent sexually transmitted disease. That is the unfortunate issue about the pills. Unlike the condoms protect you from getting pregnant, the condom protects you from sexually transmitted infections. So that is for that. So the answer is no. The pill won't protect you against sexually transmitted diseases or STIs such as genital herpes, chlamydia, all of those medical terms, viruses, hemoimmune deficiency viruses, that is HIV, a lot more. It does not, and it even does not help as it relates to the HPV to. So you have to take note of all of these things. So what you have to do is ask your healthcare provider about the best form of protection to protect you from STIs based on your sexual activity. You have to ask. So if you are someone who can flirt with anybody, there's no need for you to get on a contraceptive the pills, because the pills will not protect you from coming down with all of these infections and diseases. You are vulnerable, and so be it with the person who you are going out with. So you have to be very, very careful. If you are a woman who is all around, you have to understand this. This is where we are being blindfolded. If you are on any method of contraception, as it relates to pills, taking an injection, it does not prevent you from getting HIV and AIDS. You are vulnerable to getting HIV and AIDS. For one fact, it does not prevent you from getting HIV and AIDS. It only protects you. It only protects and prevents you from getting pregnant. The only method that helps 99% in all cases is the condoms. The condoms protect you both from getting pregnant. The condoms protect you from HIV and AIDS and other infections or diseases. Please take note. So, are there any side effects of taking the pills? Of course, when you are on the birth control pills, there are side effects you may experience. And potential side effects include nausea, where sometimes you feel like you want to vomit, you want to sneeze, and that funny stuff. You sometimes experience it. You experience headaches, irritable, or moodiness. Yes, you get sometimes irritated, breast, chest tenderness or swelling. Yes, you get your breast swells a whole lot. These are some effects of the pill. Spotting between period, it happens as well. So what you can do is you tell your healthcare provider if you are experiencing side effects that don't improve. So when you are on a pill and you are experiencing enough side effects that does not improve gradually, you should be able to contact your healthcare provider so that they can see the need to switch you or find what is better for you. You have to report it immediately. Don't go to your friend and say to your friend, "Well, I see not happening to me, but stop." Your friend unhappy and stop. Your own man not happy and stop. So you have to be very, very careful. Do birth control pills make you gain weight? Wow, no. Birth control pills does not help you gain weight. Many people ask this question before starting the pills. One thing that helps you gain weight is the IUD that it gives in the arms. It sometimes help you increase your body and all of this stuff. But when it comes to birth control pills, it does not. Many people ask this question before starting the pills. It does not. So it does not help you. It does not. Studies have shown that birth control pills don't make you gain or lose weight. That is just it. So are there any health risks to taking this pill? There are health risks, and I would like to talk about it only if you will stick and stay with me next week that we conclude it. So of course, thanks to Amara M. Donso. Thanks for joining me this morning. You came along this morning again, and you are here this afternoon. I appreciate you a whole lot. If you have questions, make use of the comment section. I will reply to you, even if I'm offline, as it relates to these issues. So the question is, are there any side effects of taking the pills? Yes. Any medicine you get in this world, that say that there are side effects. So you have to be very careful how people lie to you about it. So of course, we'll take this break. When we get back, I'll just wrap up things very, very quickly. Stay with me as I'll be right back shortly.
Okay, let's paint a picture, make it big, pointing out the pressure. Patriarchy has become official, so let's talk about it, cause I'm seeking closure. Women have a different set of rules, but they should apply to your gender too. You judging me by the way I dress, while you walk in the streets with a bare chest? Yeah, bare chest, man, it's double standards. You teach it loud, but you can't stand it. You cheat on me many times, but when I do it once, you act like your life sending. Let's talk about rape, discrimination, narcissism, that determination. To subjugate women and make them slaves, on domestic abuse, we get digging grave, fall up in my face, talk about you the man, generating fear like the boogeyman. You think you know women, you're very late, cause pure opinions, bro, you can't relate. So drop the axe at the record scratch. We done eating from an empty plate. I carry a child for 9 months, man, I bear pains you will never take. You say that women are the weaker vessel. If that is true, then we need protection. If you all were doing your jobs as men, we wouldn't be having this conversation. If I get a job, then you say I slept. If I don't, you say I'm a lazy wreck. But I'm a leader, then you feel threatened. Every day my existence is being questioned. Stop the bias. Stop the bias.
Yeah, I appreciate the advocacy, and yes, I listen to your allegations, but let me correct the misunderstanding and point out the flaws in your presentation. See, patriarchy is a word that women use every time they don't want to submit, and that is because they choose to be manipulative and put all the blame on the men. So women are never wrong, they always right. You call them out, they start to cry. You say the fact, then it's body shaming. Tell them cover up, then it's slut shaming. I walk around with my bare chest, cause I don't have to, shouldn't rest. It's simple biology, all we ask from you is decency. We are not enemies. Say narcissism and a male trait, women do it too, ask Will Smith. Domestic abuse and rape, I don't by poorly raised man, not a man. Why y'all trying to mess with God's plan? All this victim playing, I am not a fan. You talk about 9 months, but I spend my whole life working with my hands all for a woman. How is that fair? If we ain't got money, you don't care. See, I don't see women complaining about being a farmer, but yeah.
So of course this is Adam and Eve. It's a nice music. It's a nice rap for females and males to listen to. They talk about gender equality as it relates to our daily activities within the confine of our country and that of the world at large. So where women brag about carrying men 9 months and everything, he also asked him why we sometimes don't want to be a farmer, we sometimes want to be president, because we feel it's kind of relaxing. There's no it's kind of relaxing because there's no better work. It's not really tough though, but we always like to be in authority, you know. So let's get back to it. Let's get back. To birth control. The birth control has side effects. So I will talk about it and I will close up. Yes. So are there any side effects of taking the pills, the birth control pills? So you may experience side effects when you first start taking the pills. Side effects usually go away or get better after a few months. So I'll talk about the side effects. We talk about nausea, we talk about headache, the irritability or moodiness, breast tenderness, spotting between your period area. So do birth control make you gain weight? No, it does not. It does not make you gain weight. It does not make you lose weight. So that is for that. Are there any health risks to taking the pills? Yes, this is where I'm coming in. So birth control pills are safe for most people. It's the most commonly prescribed form of birth control. The pill has been available for more than 60 years, so there's a long history of people using it safely to prevent pregnancy. So a small percentage of people will take the combination that involve the estrogen containing birth control pills are at increased risks of developing these rare complications. So the combination pills we talk about has a lot of risks. Deep vein thrombosis, that is DVT, and pulmonary embolism, high blood pressure, heart attack, stroke. So these are all side effects. So your healthcare provider will discuss any concern you have. When you go to the hospital, they will be able to tell you in there, how is this feel? You will be able to ask these questions. That's the reason why we bring this platform to you, so that you can know where you stand when you are outside there talking about issues relating to women. You should know what you are saying. So you will not just go to the hospital and say, I want to get on birth control. No. You don't do that. So you will have to know all of the basic things so that you can ask relevant questions, important questions that matters. So yes, these are some side effects. We will elaborate more on the other side effects as it relates to contraception next week. Please stay with me. I'm hoping that I get a representative from Lydia Contraceptive in studio while we settle this issue. We settle this issue of contraception as ladies. Thanks for joining. I really do appreciate you a whole lot. Winston Bladding. Thanks, Winston, for joining. Beautiful. Thank you. I appreciate you a whole lot. So today, just it was summary. We talk about this month. We are talking about contraception. And the last time we talked about another method of contraception, that is the IUD, the injection, that is sometimes given for 6 months, that is sometimes given for 3 months. So today we're talking about we're talking about another matter, sorry, and that matter has to do with the effect, the disadvantages, and advantages of birth control pills. So birth control is another kind of contraception that is 99% effective. This help you prevent pregnancy only. This help you prevent pregnancy. So if you have a girlfriend who is on birth control, it does not prevent her from getting HIV and AIDS. She's on the verge of getting HIV and AIDS if the person who she's sleeping with or the person who she having an intercourse with is already down with the virus or is already having these kind of symptoms of HIV and AIDS. So all I'm saying here in sense is birth control does not protect you from any sexual transmitted infection or sexually transmitted diseases. It does not protect you for that. Keep that at the back of your head whenever you decide to get on birth control pills. The only pills that work 99%, it protects you both from getting HIV and AIDS and it protects you from other sexually transmitted diseases is condoms. In so doing, there are certain infections or diseases that sometimes condoms does not really prevent you from the due to your interference with sexual intercourse. Like we talk about hepatitis B, it's sometimes spiritual your sawala, sorry, your spit from your mouth. So these are things that sometimes lead to hepatitis B and other things. So you see, okay, we are using condoms. It helps to stop sexually transmitted infection and diseases. For your savalana, is it savalana? Yeah, killing so the spit that comes from our mouth, these are things too that transfer the issue of infection as it relates to hepatitis B, and there's a lot more when we talk about hepatitis B. So this is for this today. Thanks for joining us. I appreciate all of you on this platform. My name is Bekwin Encouragement. This is how we close up for today. I love you and Koreote, do positive things in the right way. Bye bye.